Good morning, everyone. My name is Brandy Cool with the Pennsylvania Head Start Association. I appreciate you all being here for our Free Resource Friday. Hard to believe it's June, and this is the sixth one that we are completing. A lot of familiar faces, so I appreciate that you value these sessions, and we look forward to hearing from Anna today. So, Anna, I'll pass it to you.
Awesome. Thank you so much. I really appreciate you all having me today. So my name is Anna Brash. I am the Manager of Operations and Member Services for the Pennsylvania chapter of the American Academy of Pediatrics. So today I'm just going to kind of give you some more insight into who we are and how we can help support you in your work. Okay. So just a quick orientation on who the PAAP is. So we are the state chapter of the National American Academy of Pediatrics. So that is the largest pediatric organization in the country with around 67,000 members nationwide. So as the state chapter, we were founded in 1983. We have over 2,300 physician members here in Pennsylvania and a team of 22 dedicated staff. So our headquarters are in King of Prussia, and we have remote staff that work across the state as well. So one thing that I kind of want to address is that many people assume that we're just a medical organization focused on pediatricians and their practices. But that's part of what I want to talk about is that our work goes far beyond the clinic. So we run a lot of community-facing programs and initiatives that touch families across all 67 Pennsylvania counties. So our mission is to promote equitable health and well-being for all Pennsylvania children. And we live that out through our programs of education, support, and advocacy, and in partnership with pediatricians, early childhood programs, families, and community partners. Okay. So this is just kind of a roadmap for today. So we have 6 core programs, each address different topics of early childhood health. So each of these are staffed, run, and available statewide. So our 6 programs we're going to talk about today is our First Food Network, our SCAN program, TIP, Excels, Healthy Teeth, Healthy Children, and then our immunization work. So I do want to say that while these are our core sustained programs, we also work on countless other initiatives. So that includes suicide prevention, trauma-informed care, immigrant health, disaster preparedness, emerging threats, so much more. We also collaborate with coalitions across the state that share our support or share our goal of supporting children's health and well-being. So I'm going to kind of walk through each of these programs and what they offer. So our first program is our First Food Network. So this is our breastfeeding support program. The reason that we kind of started all of this work is that only 1 in 4 infants in the US is exclusively breastfed at 6 months, even though our National American Academy of Pediatrics does recommend exclusive breastfeeding for the first 6 months. Their low breastfeeding rates add over $3 billion a year to US healthcare costs, and there are significant racial disparities in breastfeeding rates that we're working to address with this program. So we try and kind of work to change all of this by building a community infrastructure and working directly with birthing facilities to provide training and resources to best support breastfeeding parents. So we work with these facilities to implement the 10 steps to successful breastfeeding here in Pennsylvania through what we call the 10 steps to a breastfeeding friendly initiative. That is not the only thing we do. We also provide additional resources for families and communities, like our Breastfeeding Welcome Here designation signs. So this is a recognized certification to show that your setting is breastfeeding supportive. We also have multilingual family education materials in a wide range of breastfeeding topics. And we also can help connect families to local lactation consultants and WIC breastfeeding support through a community referral network. All right. Our next program is our Suspected Child Abuse and Neglect program, also called our SCAN program. So this has been a program since 1999. It was actually the first statewide child abuse education program for healthcare providers in the entire country and has actually been replicated in over 20 states. SCAN provides mandated reporter training that's required under Act 31 for provider license renewal and Act 126 for school personnel. And it's at entirely no cost to these providers. What's really important about these trainings is the way that we put them together. So it's a multidisciplinary team of child abuse pediatricians, ER nurses, county children and youth workers, and other trauma-informed practice experts who truly understand what's going on. This kind of approach has been cited as a gold standard for cross-system collaboration. Additionally, our SCAN program also offers different tools that you can use, such as trauma-informed practice guides, ACEs screening resources, domestic violence screening tools, and other prevention materials that would be appropriate for early childhood settings. All right. Our traffic injury prevention project, this is one of my favorite programs that we have here. It was actually the first program that started our chapter. This is our child passenger safety program. So we are funded from PennDOT to run this for the entire state. We lead on everything safety for bicycle safety, helmet safety, school bus safety, car seat, seatbelt, you name it. Because motor vehicle crashes are among the leading causes of injury, death in children, we work on trying to change that through Pennsylvania. So one of the big things that they run is the 1-800 CAR-BELT helpline. The really great thing about our helpline is if you or any parents you serve have questions about seatbelts, about car seats, they can give us a call and we will give them resources. One of the other most valuable things that we offer are car seat loaner programs throughout the state. So this is, again, entirely free. All that needs to happen is someone gives us a call on that 1-800 CAR-BELT. We ask no questions other than, what county are you from? Once we know what county they're from, we're able to tell them where there are these car seat loaner programs available in that county. They're able to then go get the correct car seat size for their child. It is installed properly by trained car seat technicians. And then they actually can bring it back when they need the next size up. We destroy the old car seat properly so it is not reused. And we continue to make sure these loaner programs have the correct car seats. They are not outdated. And we're making sure to continue their training as well throughout. There are also car seat fitting stations. So if families do have car seats but just aren't sure how to install them properly, we can also just send them to a car seat fitting station where, again, these technicians will help them to properly install it, show them the step-by-step process, and make sure it's the correct size, everything like that. All right. Fourth program. Some of you may have heard about this before. This is our EXCELS program, which is our early childhood education linkage system. So this has been a program since the early 90s here. It actually served partly as inspiration for the Healthy Childcare America program. So EXCELS focuses on improving quality health and safety outcomes in childcare settings across Pennsylvania. So we offer professional development and training, specifically for childcare providers, which includes emergency preparedness, mandated reporter training, medicine administration, whatever you can think of, we have trainings on that. And again, it is at no cost. We have a resource library with lots of different health policies, resource sheets, childcare specific toolkits. We also work with early learning resource, or the ELRCs, the early learning resource centers, to work with training our healthcare consultants on health and safety that can then be used by childcare centers. Our next one is our Healthy Teeth, Healthy Children program. So this is our medical dental partnership. We actually work with PCOH a lot. on our Healthy Teeth, Healthy Children program as well. So I believe they did a presentation earlier this year. If they didn't, I think I've seen one of their presentations. They are a great resource. We share a lot of resources for this program. So we typically train healthcare providers on how to deal with dental issues within the practice. We know that there are a lot of families that cannot find dentists or cannot afford a dentist. So we have been training pediatricians on how to do things such as topical fluoride varnish application and how to screen for different dental issues within their practice. And then on top of that, other resources that we provide, we have our Smile Hub with downloadable handouts on oral hygiene, diet, fluoride, how to find a dental home. So that's all on our Healthy Teeth, Healthy Children website. All right, and our final program that I'm going to talk about.
Sorry, Anna,
Yeah.
if I back you up to the
Sure.
car, there was a question. I've been trying to get car seat safety certified for our program. The location that was within driving distance was the recert program. The full cert classes are well out of driving distance. Do you offer something that could be closer than 2.5 to 5 hours away?
Where is the location that you were looking at? I mean, and if this is something that would be better offline, I can put my email in the chat and link you up with our tip team as well.
I'm in Cambria County.
Let me, off the top of my head, I don't know exactly where their training programs are, but I will link you directly with our staff that works in that county so that they can let you know exactly where their training programs are.
Thank you.
Yeah.
There was another comment in the chat as well. I got certified in car seat installation. I highly recommend the training, and it is so nice to have a person certified in your program. We did have to travel away for the training as nothing was offered close by, but our program was able to support us doing that. Thanks, Paige.
So glad to hear that. Yeah, I mean, I can definitely, if there are groups that would like to have someone trained in their center, and there's a couple in the area, I can always talk to our technicians or our trainers that work for our company and see if they can do a specialty event somewhere closer. You know, I'm happy to have those conversations. Did I miss any other questions?
No, I think just use like vinegar.
That's everything that I see in the chat.
All right. So last program I wanted to talk about is our immunization work. We work very closely with Pennsylvania Immunization Coalition. We actually have staff that staffs PA Immunization Coalition. So this is, you know, an advocacy and education organization across the state about vaccine education. Our work with PAIC has become even more important over the past several years. We work to provide resources for families, healthcare providers, childcare settings, talking about vaccine safety and the current AAP immunization schedule. So we offer tons of family-facing materials explaining recommended vaccines in plain language for families. And this is actually available in multiple languages. We run multilingual outreach campaigns via social media, via billboards, TV ads, radio ads. Specifically, we try and do this in counties and communities with low vaccine rates. And we advocate for policies that protect children's access to vaccines. One resource that I would really like to highlight is that PAIC, in addition to being a statewide organization, they have a lot of local coalitions across Pennsylvania. And these local coalitions are really great partners. They will set up vaccine clinics in your area. They will set up educational resources. So definitely, if that's something that would be helpful, I would consider reaching out to them for that. Okay. So I also want to talk about what other resources the AAP offers. Healthychildren.org is a very helpful resource for families. They offer tons of different parent-facing handouts and child health information, both in English and Spanish. They have clinical guidance, policy statements on all of these kind of topics that we've talked about today. So, oral health, early relational health, immunization, breastfeeding guidance, child abuse, all of these topics and more. They tend to talk about things throughout the year. Like right now, there's been a lot of conversations on what to do about, being out in the sun, drowning risks, things like that too. So if you have any parents that are asking questions of, what to do in the summer or things like that, there are resources on healthychildren.org as well. And then just the final thing I wanted to talk about, like I said, we do a lot of other initiatives. One of our big things is advocacy at our chapter. So we want to make sure voices of children are heard in Harrisburg. The way we do that is through our pediatricians, because children can't necessarily advocate for themselves in Harrisburg. So we have our pediatricians advocate for those children. So in Pennsylvania, we have a 2-year legislative cycle. So every 2 years, our advocacy committee creates what we call our Blueprint for Children, which is our roadmap for policy priorities. So this is just kind of a handful of our priorities. We have mental health and ACEs. So we're supporting, screenings, trauma-informed care trainings, and access to mental health services for children from birth. We know that strong parent-child relationships are keys to, promoting child health and well-being throughout. So we want to make sure that we are advocating for that. Another thing is child poverty and access to care. So we know that, around 15% of Pennsylvania children live below the poverty line. So we really champion robust funding for things like Head Start, Universal Pre-K, CHIP, Medicaid, SNAP, WIC, things that are going to help create stable foundations for children. We also advocate for paid family leave, breastfeeding supportive childcare policies. And finally, one of our big things is firearm safety as well. We know firearms are a leading cause of death for children ages 1 through 19. And so we really advocate for secure storage laws, extreme risk protection order legislation, and community violence intervention program. So this is not an extensive list. We have a lot more priorities in our blueprint. So if you would be interested in looking at that, our website, paaap.org, you can find our full blueprint for children. And then just finally, this is some of our social media. So please, we would love to stay connected. You can follow us Facebook, Instagram, LinkedIn. You can also reach out to us at info@paap.org, or I will also put my email in the chat so you can reach out to me directly as well. So I really appreciate, your time today and, the work that you all do. So any questions?
Pausing for one more moment and see if there were questions. Okay. Anna, thank you so much. This was incredibly informative. I was only a little bit aware of some of the services that you offered recently, but when I was home visiting, I definitely was not aware of any of these resources. So I'm definitely very thankful that you came on and shared with us today. As a reminder, this will be posted up on YouTube, so you will be able to access it at any time. But Anna, thank you so much for being here.
Of course, thank you for having me.
And thank you everybody for
Thank you.
joining us today. I appreciate it. Thank you for jumping